and gentlemen, if I could please call for silence for the conferring. Thank you, Terry. Presidents, Excellencies, members of Council, past presidents, deans, distinguished guests, if I could please ask for silence for the honorary conferring. You're all very welcome to the college. This, the 230th annual celebration of the award of our charter. It's now my privilege to declare open the ceremony for the conferring of Honorary Fellowships. I would like to invite Professor John Hyland, Member of Council of the Royal College of Surgeons in Ireland, to come forward and read the citation for Professor Richard John Heald from the Pelican Cancer Foundation, Hampshire in the United Kingdom.
President, it's my great pleasure to present to you Professor Richard John Heald, otherwise known as Bill Heald, for Honorary Fellowship of our great college, the highest honour we can bestow. Professor Heald is, and I don't say it lightly, he is an absolute surgical colossus. His surgical career befits this title. Bill is a graduate of Cambridge University, Commander of the British Empire, Master of Surgery, Fellow of the Royal College of Surgeons of England and Edinburgh, and Honorary Fellow of the American College of Surgeons. He is Professor of Surgery in Southampton University and Consultant Surgeon at Basingstoke in North Hampshire Hospitals NHS Trust and Director of the Pelican Cancer Foundation. Bill is a specialist in colorectal surgery and arguably has contributed more to the management and treatment of rectal cancer than anybody else in the last 100 years. Rectal cancer, if managed incorrectly, can result in horrific morbidity and inevitable mortality. In the early 1980s, Bill Heald pioneered and popularized the concept of total mesorectal excision, a procedure for rectal cancer based on defined embryological, anatomical, and pathogenetic principles, which over the years, through his leadership and enthusiasm, has become the gold standard of the surgical management of this disease. This has resulted in greatly decreased local recurrence rates, considerably decreased complications, and higher cure rates in all of the countries where this technique has been adopted and performed correctly. Professor Heald is a passionate educator. He's an international teacher and superb communicator, and a surgeon's surgeon. He has dedicated himself over the years to training surgeons in the United Kingdom and the international community in the technique of total mesorectal excision. He has performed over 400 live operative video broadcasts of TME all over the world in more than 30 countries. He has multiple honorary professorships and awards from countries throughout Western and Eastern Europe, Australasia, Africa, and North and South America. He has over 140 papers in the peer-reviewed international literature. He is also a veritable hibernophile. He has trained several Irish surgeons, and over the last 20 years or so, he has developed an amazing professional relationship with his colleague, Mr. Brendan Moran, one of our own fellows, and it's great to see Brendan here tonight. Together, Bill and Brendan have developed the Pelican Cancer Centre and continue to advance the management of rectal cancer with such projects as multidisciplinary team management and the Mercury project investigating magnetic resonance imaging in the staging of rectal cancer, and indeed peritoneal resection for metastatic colorectal cancer. They have educated teams of surgeons, oncologists, radiologists, pathologists, and nurse specialists from throughout the United Kingdom in the overall concept of multidisciplinary team management. They kindly indeed allowed our own team to participate with them several years ago. At a personal level, Bill is a dedicated family man. He's married to Denise for nearly 45 years and has 3 charming daughters, Sarah, Lucia, and Anna. He is also partially famous because he is father-in-law to Tim Henman, the tennis player, for those of you who don't follow tennis. Above all, Bill is a charming man, a communicator extraordinaire, great company, and so thoroughly committed to the health and welfare of his fellow men. President, it's my pleasure to present Professor Bill Heald for Honorary Fellowship of our college in the knowledge that you will find him truly deserving.
I, Bill Heald, do solemnly and sincerely declare that I will observe and be obedient to the statutes, bylaws and ordinances of the Royal College of Surgeons in Ireland, and I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of the said college.
And by virtue of my office as President, I admit you as an Honorary Fellow of the Royal College of Surgeons in Ireland. Congratulations.
Really? Yeah. I'm just going to put it on. Yeah, sorry. Yeah. 14, I think.
Yeah.
Ladies and gentlemen, I would now like to invite Professor Kevin Conlon, Member of Council of the Royal College of Surgeons in Ireland, to come forward and read the citation Professor Donald Edward Lowe, Head of Thoracic Surgery and Thoracic Oncology, Director of the Esophageal Center of Excellence at the Digestive Disease Institute, Virginia Mason Medical Center, Washington, United States.
Mr. President, Vice President, past presidents, members of council, fellows, members and guests. Seattle is known to its residents as the Emerald City, and it has many distinctions similar to Dublin in that it receives the largest rainfall of any city in the United States. It's famous for its Space Needle, Boeing Starbucks, Pike Place Market, and now, of course, the home of the newly crowned Super Bowl champions, the Seattle Seahawks. It's also home for Dr. Donald Lowe, who we honor this evening, his wife Diana, who we welcome to the college, and his children, Sally, Alex, and Katie, who unfortunately cannot be with us tonight, but I have no doubt are with us in spirit. Dr. Lowe was born in Toronto and moved to Kingston, Ontario at the age of 10 when his father was appointed to the chair of obstetrics and gynecology at Queen's University in Kingston. He was educated at the Loyalist Collegiate and Vocational Institute, and the reason I mention this is I found out that the colours of this institute were green, white and gold. It explains who he was cheering for this afternoon. From high school he attended Queen's University in Kingston, where he excelled academically, obtaining an honours BSc in biology and history. He was also not only a scholar, but an active sportsman representing the university in golf. In fact, Mr. President, despite his denial, I suspect he still has a mean swing, as he plays every year in the Pro-Am of the PGA senior event, the Boeing Classic. His medical education was also at Queen's University, where he graduated with an MD degree in 1981. He had decided early on a surgical career and completed a surgical residency in the University of Toronto and Queen's University Kingston, where he graduated as chief resident in 1986. Following his residency, he crossed the 49th parallel and became a research fellow in thoracoesophageal surgery at Virginia Mason Center in Seattle under the renowned thoracic surgeon Dr. L.D. Hill, and thus commenced a relationship with the esophagus, Virginia Mason, and Seattle that persists to this day. But his travels were not completed. He actually spent 2 fruitful years as a thoracic registrar in the United Kingdom in Exeter, Coventry, and Birmingham, and he thoroughly enjoyed his time at during that time, and it was during that time he made the first of his 7 visits to Ireland. He returned to the United States in 1990, and he was appointed to the highly prestigious position as Fellow in Lung Transplantation in Barnes Hospital in St. Louis under the mentorship of Drs. Joel Cooper and Larry Kaiser, iconic figures in modern thoracic surgery. On completing his fellowship, he returned to Seattle and joined the Department of Surgery at Virginia Mason Medical Center, where as we have been told, he is currently the head of the section of thoracic surgery and thoracic oncology and director of esophageal cancer for excellence under the Digestive Disease Institute. He has many areas of surgical expertise, and these include gastroesophageal reflux, esophageal motility disorders, and management of esophagogastric cancer. He is board certified in both general and thoracic surgery by both the Royal College of Surgeons of Canada and the American Board of Surgery, and he is a fellow of the American College of Surgeons and the Royal College of Surgeons of Canada. Dr. Lowe has won countless awards and distinctions and is affiliated with multiple professional organizations, which include the Society of Thoracic Surgery, the Western Surgical Association, the American Society of Clinical Oncology, and he's the current president of the Seattle Surgical Association. His research has centered on refining process and developing quality measures for esophageal and thoracic surgery. He's published over 100 peer-reviewed articles and book chapters. And to paraphrase George Bernard Shaw, progress is impossible without change, and those who cannot change minds cannot change anything. As is obvious to his contributions to this meeting, it is clear that Dr. Lowe has clearly aimed to change minds. He created and has led at Virginia Mason a world-renowned multidisciplinary unit which has been focused on the care of the esophageal patient. The Virginia Mason results for benign and malignant esophageal disease are amongst the best in the world. But Dr. Lowe and his colleagues have not been content to rest on their laurels, but have continually challenged their results and themselves to improve their ongoing practice, and as a result have improved clinical care in multitude of units in the world. An example is the standardized clinical pathway for patients undergoing esophagectomy, which he described yesterday during his superb Collis lecture. This has resulted in 90% of their patients being mobilized on the day of surgery, a mean ICU stay of 1 day, and coupled with a mortality rate of less than 0.4%. Truly remarkable results. As I have said, he has enabled change, while I must say, slain some old surgical dogmas in the process. Mr. President, it is a great pleasure to present to you Donald E. Lowe, surgeon, educator, and spectacular researcher, who I'm sure you will agree is worthy of the highest distinction this college has to offer, the Honorary Fellowship of the Royal College of Surgeons in Ireland.
I, Donald Edward Lowe, do solemnly and sincerely declare that I will observe and be obedient to the statutes, bylaws, and ordinances of the Royal College of Surgeons in Ireland, and I will, to the utmost of my power, endeavor to promote the reputation, honor, and dignity of the said college.
By virtue of my office as President, I admit you as an Honorary Fellow of the Royal College of Surgeons in Ireland. Congratulations, Don.
Ladies and gentlemen, I now declare the formal proceedings closed. The platform party will leave the hall in reverse order, and I'd request our guests to proceed to the examination hall where dinner will commence. Thank you very much.